Hello, everyone, and thank you for joining us this afternoon. This is the third webinar in a series hosted by the EERI San Diego chapter, applying lessons learned from COVID-19 to earthquake preparedness. Today's presentation is called Next Steps for Earthquake Preparedness in Our San Diego Community. And the previous two webinars that we've already had are available on our website, which is sandiego.eeri.org. And for any of those of you who missed the previous ones, you can access that to view the recordings. Our third presentation is, before we get started with the presentations, if you have questions, there's a question panel. These will be addressed afterwards, but we ask that you please address your question specifically if there's a particular speaker that you'd like to address your question, that you note it, and that your questions are clear, and we will address them all at the end. The speakers today are Dr. Jorge Meneses, who's a principal geotechnical engineer with the RMA Group. He's a California Seismic Safety Commissioner and the president of the San Diego Regional Chapter of EERI. Our second speaker will be Ryan DeHart, who's the Emergency Services Coordinator for the County of San Diego Office of Emergency Services. And our third speaker will be David Harrison, who's the Assistant Director for Emergency Services in the city of Carlsbad. And with that, I give you Jorge.
All right. Thank you, Kristen, and thank you, everybody, for attending this third webinar of this series of 3 webinars that we organized here in San Diego. So what I'm going to do is a kind of recap or what we presented back in March this year in the National Earthquake Conference. We unveiled the results of our earthquake scenario that took about 5 years to do. So I'm going to just present a summary of the results, the findings of that scenario, and then what could be the road ahead. The scenario is just the starting point. So now comes the more difficult part. So this is the outline of my presentation. First, a quick recap of webinars 1 and 2. Then some important findings, highlights of the San Diego earthquake scenario. And then what will be the road ahead, our vision 2050 and seismically resilient San Diego. And finally, some conclusions. So just a quick recap of our previous 2 webinars. So we discussed what are the scenarios, what is the idea, why we do scenarios. We review the concept of the scenarios and also how scenarios were applied to assess the impact of different hazards, including pandemics, including earthquakes. And we review some of them and we realized that, for example, in the case of scenarios for pandemic, there is nothing new about the main findings that scenarios were highlighting for pandemics. Scenarios, again, are just the beginning. No matter what hazard they are simulating with the scenario is always just the beginning. Then we have to, of course, communicate these the findings of the scenario to the stakeholders. So we need to begin developing more resilient communities. So we need to plan now. Then in the second webinar, we discussed about communication. Okay, we did this scenario. We found some important findings. And now how we communicate this risk, this hazard to people, to stakeholders, to authorities, to decision makers, etc. So we discussed the challenges, for example, of communication in the current pandemic, and also the misinformation going around about the pandemic, and also misinformation when we are dealing with earthquakes. I feel very, very frustrated, for example, when I talk with people, lay people, about earthquakes, and they started asking me about the triangle of life. And they don't ask me about the drop, cover, and hold, but the triangle of life. So I think that there is still much room there to do in terms of education, raising awareness, etc., to population, and also, of course, to some decision makers. And then finally, we discuss also the social vulnerability and issues related to social justice when we evaluate hazards, and especially the impact of the hazards. Typically, if we see hazards all over the world, typically the poor are the more affected. Those who are with social and economic status in disadvantage are more affected. So this is also very, very clear here in the current pandemic when we see, for example, the impact to people according to race, ethnicity, level of income, etc. So then finally, today we are going to see, again, review quickly some of the results of this earthquake planning scenario that we developed for San Diego region. So this scenario uses a model earthquake to illustrate the geologic hazards, estimate the damages to the buildings and infrastructure, the potential social disruptions, and economic losses, of course. Assess the level of seismic vulnerability of the San Diego community, and inform long-term earthquake and resilience planning and preparation. We want to raise awareness about the potential hazard of this Ross Canyon fault that runs parallel to the shore, but also runs, through San Diego, downtown San Diego. In 1990, it was published the first planning scenario for the region San Diego-Tijuana, and we realized that this scenario needed to be updated. So that's why we embarked like 5 years ago to update the scenario, and finally, back in March this year, we released the updated scenario for the San Diego region. The main hypothesis you see here, somehow the trace of the fault, of the Ross Canyon fault, and this is going right through downtown San Diego and then going again offshore. So this is the hazard that we face here in San Diego. This is one of the particularities associated with San Diego that is running through downtown. One of the first things that we did was to see, okay, we are going to decide what will be the scenario earthquake, and we put together all the experts about, about the fault, the Ross Canyon fault, seismologists, geologists, engineering geologists, etc. And then after several meetings and discussion, we decide what could be that scenario earthquake. That is a plausible earthquake, of course. Magnitude 6.9, strike slip, and would have a surface expression of fault rupture of 2 meters. So this is about 6-7 feet. And the recurrence interval for this potential rupture is about 1,000 years. As a result of this earthquake scenario, what were our main findings? Region-wide, the loss estimates are as follows. We use the computer program HAZUS that was developed by the United States Geological Survey, and we estimated that there will be about $38 billion in building and infrastructure damages, about 8,000 buildings damaged beyond repair, 120,000 buildings suffering moderate to complete damage, and about 36,000 households displaced by the event. Some key findings. Many older, more seismically vulnerable buildings constructed before modern seismic design provisions were in place, including several key City of San Diego facilities, may be severely damaged, with multiple older buildings potentially suffering partial or total collapse. Due to the location of the fault rupture zone, coastal communities may be cut off from the nearly all lifeline utility and infrastructure services. Water, wastewater, and gas line services west of the fault rupture zone are estimated to be out for months. Transportation lines along the I-5 corridor could be severely impeded, with potential roadway and bridge failures within the fault rupture and liquefaction zones. Impacts to these systems would present additional challenges to emergency responders, of course. I want to emphasize here that there are three hazards if this scenario earthquake occurs. One will be intense ground motions around San Diego. The other one will be liquefaction and lateral spread. So that means the ground failure affecting several infrastructure, facilities, etc. And finally, the surface manifestation of the rupture of the Ross Canyon fault. So this will cause a significant disruption that we are now describing. Response to fires caused by gas line breaks and electrical failure or malfunction would be challenging, with a loss of water pressure from damaged water systems, especially in coastal communities. Infrastructure critical to the regional economy included the San Diego International Airport, the Port of San Diego, and several Department of Defense installations may be severely disrupted. Damages to over 100,000 residential structures, coupled with current high housing costs and low vacancy rates, may exacerbate existing housing affordability issues in coastal communities and potentially cause residents to leave the region. We have to emphasize that San Diego is one of the most expensive cities in California. So what do we do about it? Okay, we performed the scenario, we estimated what could be the impact, the damage to buildings, infrastructure, etc. And now what we are proposing is a vision 2050, seismically resilient San Diego. So we are proposing what could be the steps for the path forward and to provide, to increase safety to San Diego and also to improve resilience. The San Diego County Resilience Program conducts a county-wide resilience review. You see there the document. Develop a regional seismic mitigation strategy that identifies actions, priorities, and funding for projects. Compile inventories of seismically vulnerable structures and develop seismic risk reduction programs. Assess local land use and zoning practices and recommends actions to reduce risk to the built environment. Utility stakeholders coordinate resilience, planning, emergency response, and mitigation of lifelines networks. Wastewater utilities also. Wastewater utilities alleviate dependencies on vulnerable infrastructure and facilities. Water utilities prioritize investments to prevent prolonged disruption in coastal areas. The port addresses seismic hazards in upcoming revitalization plans. Emergency managers update emergency response plans to address the Ross Canyon fault zone hazard. Conduct public preparedness campaigns to educate residents and businesses about the Ross Canyon fault zone hazard. And finally, we understand that San Diego is not an isolated entity. I mean, the San Diego-Tijuana region is a very, very lively region, very active from economic point of view, international trade, etc. So we have to coordinate because whatever happens to San Diego will affect Tijuana, and whatever happens to Tijuana will affect San Diego. This is something also that we are experiencing now during this pandemic. So it's needed to integrate agency counterparts in emergency planning and response exercises to build capacity in cross-border coordination. So these are more or less that we are drafting now what could be the next step, the path forward to develop a San Diego earthquake resilient community. So combining these findings from this scenario with the current with the lessons that we are learning from the current pandemic, with issues associated with climate change, the rise of the sea level. We understand that there are coastal facilities here in San Diego that are already addressing this issue. So I think that we may create a more resilient community here in San Diego. Thank you for your attention. Kristen?
Thank you, Jorge. Up next, we have Ryan DeHart speaking from the County of San Diego.
Good afternoon. I want to thank EERI for having me on to discuss a bit about COVID-19, our response to COVID-19 and lessons learned and how we can apply those things to large-scale disasters such as the Rose Canyon scenario, to which Jorge had just mentioned. Again, my name is Ryan DeHart. I'm an emergency services coordinator with the County of San Diego's Office of Emergency Services. And today I'm going to cover a couple different topics. One is just to go over the timeline of events for COVID-19, kind of a high-level look at that to ensure that you are aware of kind of these different formatting and modules that we had developed over the time of COVID-19. Go into some communication strategies that we instituted during COVID-19, and then some that we would institute during a large-scale earthquake event, such as the Rose Canyon fault line scenario. Balancing multiple disasters. So when we look at COVID-19, the different disasters that were encompassed within that, and then adapting response functions during a pandemic. So we'll do a case study of a specific subset within response and how we go about developing those for the current situation. So first, timeline of response. So it starts from left to right in terms of our involvement within COVID-19. February 1st, OES, or Office of Emergency Services, and PHPR, or Public Health Preparedness and Response Branch, begins coordination with Marine Corps Air Station Miramar regarding repatriated citizens from Wuhan, China. So this was our first experience and first response function into COVID-19, and this was involving repatriated citizens coming from Wuhan, China, that were being brought back into the United States and serving a 2-week quarantine at the beginning of the pandemic. Our office coordinated with MCAS Miramar primarily as a sheltering capacity. Those individuals were being sheltered within the different areas within MCAS Miramar. So we worked with Federal Health and Human Services to ensure that they had what they needed, both for toiletries, food, sheltering, supplies, those types of things during that time. February 14th brought both a local emergency proclamation and a public emergency proclamation. So this was when we started to see the initial COVID-19 individuals from that were being repatriated actually having COVID-19 and then being introduced into our healthcare system. So we decided to proclaim at that point. March 13th, we have our first community positive case within San Diego. So this differs from those that are repatriated in that this was independent of that response effort. And on the same day, our Emergency Operations Center and Medical Operations Center, both EOC and MOC, activate to the highest level. Just for clarification point there, we were already activated in a ramp up to this when we initially proclaimed, but at lower levels, once we had a community positive, we moved to the highest level. Our EOC would operate for 116 days afterwards. The Medical Operations Center is still actively activated and currently responding to COVID-19. March 15th, 2 days later, the first health officer orders and stay-at-home orders are issued by Dr. Will Mawutin. This was in line with the state of California's decisions as well. We echoed a lot of what they did within that. March 17th, 2 days after that, we began to house those that were experiencing homelessness and those that were positive but needing isolation. So that was done in a multitude of ways, by establishing hotel contracts and putting people into hotel rooms, and also via sheltering with advice from experts with infectious disease on how to go about that. And we'll talk a little bit about that later on in our slideshow as well. Also establishing response sectors. So this was the subdelineation of different areas of response, specifically within the community. So we established religious subsectors. We established healthcare, logistics, PPE logistics. All those things were assigned staff and given goals and directives from our policymakers on how to respond to this and how to coordinate with the state and federal CDC and California Department of Public Health. Finally, April 28th, the T3, so test, tracing, and treatment strategies introduced and implemented, and public health sites are expanded. And what's important to notice about this, or to note about this, is that we were doing testing pretty much from the point that we had activated our EOC, but this expanded that capacity. So this formalized and created a network of both contract tracers, assistance for PPE to healthcare facilities and to healthcare systems, and then also expanded our public testing capacity to be more inclusive of just those in the public, and also established funds to allow them to expand their ability to test multiple people over a shorter period of time. I want to talk a little bit about communication methods. I wanted to touch on this specifically because it applies to pretty much every response that we have. If you go into most after action review, or after action reports, pardon me, for most events across the country, communication is one that is always highlighted, something that we're constantly improving on, and it's something that is a difficult thing to coordinate, especially when you have a large scale incident such as a COVID-19 or a major earthquake. I want to talk a little bit about the methods utilized for COVID-19, both internal and external. So the first being that beginning on the first day of full-scale activation and up until I believe 3 months after that, we were having press conferences that were scheduled daily. Those changed to I believe Tuesdays and Thursdays after that 3-month mark. But this was established to go out and talk about where we are as a county and as a state and federally, and also to discuss what we were doing in terms of that, and giving guidance to members of the public on how they can act and to help combat and limit the transmissibility of COVID-19. And this would be utilized as well during earthquakes. We'd have policymakers and high members of the public going out to talk about what's currently happening and what you should do, those types of things. Obviously, this isn't a response necessarily the same way that a wireless emergency alert would give advice, but this is something that's very important in terms of getting messaging out in terms of that disaster. Additionally, an opt-in text-based system was used to automatically update the public on changes and updates. So this was something that we rolled out a couple days after our full-scale activation. This was something that you could go to a website and sign up for, and this would update the user via text if there was changes to the health officer order. If there was, I believe we did a couple of the texts that just gave updates on where we were at statistics-wise for the county. This was developed to specifically update for COVID-19 and was different from our Alert San Diego system that is used for other types of emergencies. Social media pages, this was extremely important. We use social media for pretty much every disaster that we have to pass along information associated with what is factual and what is being vetted through our county and state governments. Ready San Diego, we have a website. It is shown on the right there in the middle that shows updates to what's currently happening. And we also have an application that mirrors that. So as health officer orders changed or if testing sites were updated, we would update our website to coordinate that and to update that and make sure that that is the most up-to-date information currently happening. And then internal communications. One of the biggest difficult factors, I suppose, of this COVID-19 pandemic, and we're seeing it in every facet of working, and it did affect our ability to work, is because there is a pandemic, we weren't able to run our EOC the same way that we would normally do it, which is 150 people in a room. So we were utilizing different areas of our campus and coordinating via Microsoft Teams and live streaming. This was something that we were not necessarily we were new to it, and it took a minute to adapt, but it's something that beyond the pandemic we'll continue to use, and we use currently as we still are in the pandemic. Want to touch on also methods that would be likely utilized during an emergency or an earthquake, pardon me. So those would be WEAs, or wireless emergency alerts. So the picture on the right, the presidential alert that was conducted last year, that would be an example of a wireless emergency alert. And that'd be something that we would utilize to ensure that we have the most up-to-date, this is where you should go, this is what's happening, getting quick information out to members of the public. This is also not an opt-in system, so as long as you have a relatively modern cell phone, you are automatically installed within this system. Second would be the emergency alert system, or EAS. This is something that we have control over that will bypass radio and TV channels to pass along emergency alerts. If you've ever been awake watching ABC at 2 o'clock at night, you'll hear tones and see a test notification that goes across. That's the system. So we would utilize this for those that don't have, if cell phone services out. Those would go onto radios, and which is a reliable way of getting communication or mass communication out. If we have internet and phone outages, that would be able to let people know what's currently happening and give them guidance on what to do if there is services open to them at that time. Final is internal. So this is our radio county call communications. During these events, all of our standard operating procedures tell us to conduct what's called a county call. And this is in conjunction with different dispatch centers within the operational area. And we would coordinate with them to ensure that they are not affected, or if they are affected, what is currently happening. It would just be a status update across the board for all the dispatch centers within San Diego County. And that way we would get a better idea, both geographically and in terms of response capacity, what is currently happening on both those levels. Concurrent responses to disasters. So this was something that we experienced within this disaster, COVID-19, was civil unrest events and the Valley Fire, which was in September of this year. So civil unrest events, we saw that in May, June, and July of this year. Different protests within the cities of La Mesa, Poway, San Diego, and others. There was property damage and high visibility, not only locally, but across the nation, multiple protests happening across the nation. This is a long-term response, so multiple nights. One thing that we found from this is that we had our operations center currently activated. So we had to do 2 separate activations and figure out capacity within infrastructure to where we were going to go for these 2 different events. We were able to figure that out relatively quickly. But what's interesting about this is that pandemics and these types of situations are longer term activations. So this was something where we were running multiple nights concurrently of monitoring these actions, where COVID-19 has now been an activation for over 10 months. So that was an interesting aspect of it. Valley Fire was different. We had deactivated our EOC for, or transitioned out of our facility for the EOC, I should say, the time that Valley Fire happened for that purpose. We knew that we were going into a pretty substantial fire season. Valley Fire destroyed 66 structures, had 17,500 acres burned, and had coordination for shelter for displaced families, and we'll get into that in a little bit too. What was challenging with this is finding resources, so especially staff resources. We normally coordinate and practice for fires, but putting a different layer of COVID-19 into that, we had to find ways of adapting certain practices, such as sheltering, which we'll get into in the next slide, but also finding the resources beforehand. And we knew that this was something that was going to potentially pop up, so we had a couple months to prepare. But those types of those types of adapted changes are something that would definitely happen during a Rose Canyon scenario, and something that we have advanced planning for to institute that and understand that early on in our response. So case study for specific functions of response during pandemics, specifically sheltering. This was one thing that we were very concerned about going into fire season, knowing that the high risk for fires was there. And we saw that across the state of California this year, multiple fires during pandemics. One of the challenges was the transition away from congregate sheltering. So normally we would have gyms, schools that would be coordinated to be our primary sheltering option. And we could no longer do that or do it in the way that we had initially or have done in previous years for obvious reasons. We want to limit the transmission of COVID-19. So that was a challenge that we had. Multiple partners and stakeholders. Sheltering is not just one individual entity, it's multiple non-governmental organizations such as the American Red Cross, Salvation Army, even our greater voluntary organizations active in disaster or VOAD. And then also within the county, within the county, there's public health preparedness and response, emergency medical services, aging independent services that all have a factor within that. Not to mention cities, such as the city of Carlsbad, who is the next presenter for this, who we coordinate with out of the operational area. If you add to that limited resources due to COVID-19, especially staffing resources, this became quite a bit of an issue. And something that I think we can take and learn from in terms of how we adapted into a earthquake scenario, because we were able to subdelineate and find resources based off of that. We were able to determine who is the person who can lead and how to share between the different events for public health or public health nurses during a sheltering event. Implementation of COVID-19 considerations for temporary evacuation points was something that we found to be extremely useful. Temporary evacuation points being areas that people in the public that are being evacuated can go to get information to receive services if needed prior to going on to sheltering. And we were able to get a lot of that, a lot of the logistics of putting people into hotel rooms, activating of those, get boss a little bit of time during response to be able to implement those things on our end, so that the end result was that we could get people into hotel rooms for Valley Fire specifically. Transitioning into non-congregate options for sheltering, we were able to work with the American Red Cross and utilize their system to put people into hotel rooms consistently, which was something that was very effective during that response. We'd also identified some congregate shelters if we did need that. And then we'd also, prior to this, and this is getting into the third point, worked on updating our pandemic or shelter protocols and shelter handbooks to include the pandemic aspect of that. So what would it look like to have a congregate care setting, or congregate sheltering setting, pardon me, during a COVID-19 crisis? How would we do that? What does that look like? What do we need to pass along to people that are working on the ground, and also to shelter managers, people that are working within the field? So we updated those protocols, updated what we needed to do associated with guidance from federal and state partners, and then also developed a new video-based training that we were able to give out to volunteers within the county system that would normally be working at those shelters. So not only that we're updating the document itself and the documents associated with that, we're actually training those people in a limited amount of time to prepare for wildfire season. That, I believe, is my last, or sorry, one more thing. So earthquake applicable concepts, so dedicated planning teams, ensuring long-term view of disasters expressed to decision makers, and identifying potential gaps early in response. So those two concepts is ensuring that we have awareness down the road if we have this type of long scale event, the potential gaps and responsibilities that we will have as a county and as a OA for response. Diversity and implementation of strategies, so section calls and subject matter experts to lead specific subsectors of long-term operations, and changing adaptive technology, again, what we saw with Microsoft Teams and not being able to run business as usual. And specialization of response to multiple incidents, so ensuring that continuity of staff and long-term and multiple concurrent, or long-term and multiple concurrent responses, ensuring that we are having specialization. So Medical Operations Center runs a specific health-related types of portions of response and has the resources that they need, that law enforcement has what they need, what fire operations have what they need out of the Emergency Operations Center. We were able to really implement that in a real sense during this disaster, and that would be something that we would apply during a Rose Canyon scenario in a very short period of time. That one was my last slide. I apologize. I appreciate it. My contact information is there, and then I will wait until the Q&A session if there's any questions for me. Thank you.
Thank you, Ryan, very much for your presentation. And up next, we have David Harrison from the City of Carlsbad.
Thank you all, and thank you for this opportunity to contribute to this EERI presentation. I'll be continuing in the discussion of how emergency managers are developing and taking next steps for earthquake preparedness. As introduced, I'm David Harrison, Assistant Director of the Emergency Services for the City of Carlsbad. And the first thing I probably wanted to talk about briefly was the topics I'll be talking about in the next 15, 20 minutes. A very, very quick overview of the City of Carlsbad. I mean, after all, it's understandable why we have the County of San Diego involved, but to have the local jurisdiction and a city perspective, I think just adds to the value of today's discussion. So I'll talk to you very briefly about the characteristics of the City of Carlsbad. We'll talk some about city preparedness, how local jurisdictions can prepare for these low probability, high impact disasters, whether that's a pandemic or an earthquake or other impactful disaster. I will include some of the preliminary lessons learned from COVID-19 and how they are shaping our emergency services response support operations. And we'll talk a little bit about what we've done and what we'll continue to do in terms of preparing our community for these disasters through outreach. Just very briefly, Carlsbad is a seaside city on the northern boundary of San Diego County. We are the fortunate home to a number of world-class communities and resorts. Our business sector clusters include hospitality and tourism, info and communications technology, life sciences, action sports and manufacturing, and clean technology. The importance of planning for these large-scale disasters, impactful disasters, becomes more apparent when we look at the infrastructure in Carlsbad, the critical infrastructure. We are home to the largest desalination plant in the Western Hemisphere. We have substantial real estate, retail, industrial, and office holdings. And when you look at our assessed value of city assets, we are the second highest assessed value in San Diego County. An extension of the Rose Canyon Fault is the Newport Inglewood Rose Canyon Fault System. And the picture on the right illustrates that fault system and its proximity to coastal Carlsbad. And I'll talk in a minute about the significance of this fault system and how it exacerbates the potential threat from the Rose Canyon Fault itself. FEMA has estimated that annualized earthquake loss of the San Diego Carlsbad system ranks 8th in the nation. So in preparing for earthquakes and some other of the large-scale potential hazards, we consult references, of course. And one of the ones relevant to earthquake planning is the State of California, Southern California Catastrophic Earthquake Response Plan, which has been in an upgrade mode for a number of years now, 3 or 4 years, but it's a very dense, comprehensive document. And I'll talk a little bit later how we are ensuring that our Emergency Operations Center response actions are coordinated and integrated with the state response plan. Of course, Dr. Meneses earlier talked about HAZUS data and lost estimates for earthquakes. We review those. That's kind of pictured on the left of the screen. In the center of the screen, you'll see a table that is the summary of potential hazard-related exposure and losses in Carlsbad. And the bottom row talks about potential earthquake losses to both residential, commercial, and other critical infrastructure facilities. So Carlsbad is vulnerable to damage from earthquake, both land-based earthquakes, Rose Canyon earthquake, or offshore earthquakes like the Newport Inglewood Rose Canyon fault system. This is a screenshot of Carlsbad's Emergency Operations Center. This picture shows a configuration we call a virtual activation. It just means that all the electronic information collection resources are energized and being monitored by a single staff member, either myself or another from the Emergency Services Department. And we pay attention to earthquake shake activity, both through mobile apps and by USGS and Carlsbad Integrated Seismic Network information. These screenshots were taken from 2016. There was an earthquake swarm, which is not all that uncommon in the southeast section of the Salton Sea. And so we pay attention to this activity just so that we can be as prepared as possible should any ruptures occur that have consequence for the city of Carlsbad's infrastructure or residents. This next slide is a screenshot of our EOC laptop desktops, and we have about 25 laptops in our Emergency Operations Center. And the key feature of our laptops is that all of our emergency planning documentation, our EOPs and our hazard specific appendixes, we have 31 of those, everything from active shooter A to Z, active shooter through wildland fire to Zika infection. We had plans for that. So they are contained in our EOC current incident folder. And when we staff activate the EOC, all the staff members open this EOC incident folder to the incident that's occurring at that time. And so one of the key elements inside of this folder is our city's framework for responding to large-scale incidents. And it's a framework built on the Incident Command Systems Management by Objective concept. And we have pre-planned response support objectives for all just about all 31 of those hazard-specific potential incidents at Carlsbad that I kind of referred to a minute ago. For earthquakes, we have 28 pre-planned objectives in 4 categories. Those categories are objectives related to scene or environmental safety. Earthquake occurs, what do we need to do to ensure that our responders are safe and our residents are safe? We have another objective related to situational awareness. How do we know what is current, relevant, concrete information for decision making? The third bullet, response support, is subdivided into a couple of sub-elements, but one of the principal ones, objectives in the EOC, is survivor management. In 2 slides in the future, I'm going to talk a little bit more about survivor management. But of course, the EOC also provides responder support. We coordinate mutual aid between jurisdictions, including the county. We have a lot of our planning has been the result of a strong relationship and strong leadership from the County Office of Emergency Services, DeHart's organization. And we try and mitigate the impacts of these large-scale disasters on the environment to the best of our ability. I'm going to talk a little bit about the last bullet there, continuity of operations. Played a very large role, both in the COVID-19 pandemic, and would play a large role if we were responding to a large-scale earthquake. So I want to give you some more information on that in a couple slides down the road. The purpose of these objectives that I've been talking about for each of the incidents is to define the scope of work. Each of the objectives is broken down into many tasks. So I mentioned that we had about 28 objectives for earthquake for the city of Carlsbad. But when you break those objectives down into tasks that need to be completed to attempt to restore the pre-incident status quo, we have over 300 pre-planned tasks. And all of these tasks have been assigned to action officers in advance. These are written out. We have tear sheets. When they walk into the EOC, they're not starting from a blank sheet of paper. Not only do they have their tasks in hand, they've been trained on those tasks in advance. So when they walk into the EOC after an incident, they are immediately assigning resources to start the completion of those tasks. All of this is geared towards a quicker response to these large-scale incidents. This slide just shows some of the objectives associated with the survivor management objective category for earthquakes. You can see damage assessment to signs up as just gaining the incident details and a resource available for incident response when a large-scale incident occurs, conducting a safety review of the status of our buildings and whether the red tag status of those buildings. Ryan has already talked about notification. Notifications, the key role notification plays in keeping the public aware of the potential hazards associated during these large-scale disasters. We also have to evaluate whether we're going to be evacuating population sections or having them shelter in place if it's safe to do so. We have an objective related to the physical conduct of those evacuations and how we provide support for those that are safely sheltering in place. Mass sheltering is another objective that the city of Carlsbad has developed. We have our own sheltering capability independent of the Red Cross, but it's meant to supplement our regional capability. We have other objectives related to traffic management, traffic flow, medical device charging, supporting those that are medically fragile or those with access and functional needs. And certainly during earthquakes, we want to know the status of hospitals and be coordinating with the county's medical operations center for that information. And then down the road, repopulating those that have been evacuated. It does just give you a sense of some of the objectives that we have pre-identified for the earthquake scenario. All of our city objectives have been crosswalked with the state earthquake response plan, the state emergency operations plan, and when after we completed that crosswalk, we wound up with more objectives and more tasks. We almost more than doubled the number of objectives that we pay attention to, and the tasks that we need to complete to make sure that our work is consistent with not only an operational area of the county, but with the state response to the earthquake. So the benefits of this objective and task resource model is that we have really reduced our paper emergency operations plan into actionable tools that are used in the EOC, work lists for pre-identified action officers to complete. When we activate our EOC, the work does not start from zero. We have it pre-planned out, and each of these positions has a work list, and so they are executing the response support operations in parallel, not in sequence. Once again, all with the interest of responding quicker. And because these are pre-identified, we conduct training on these actions, and our staff is familiar with them. Has a couple other as well, but I'll move on. Dr. Meneses has done just landmark work in developing the update to the Rose Canyon fault scenario. We've studied that, we've paid attention to it, but based on perhaps a little bit of data it has this information, the impact to Carlsbad from the Rose Canyon fault proper is not going to be all that significant. But we could suffer more damage and displacements from a larger earthquake from the fault system, the Newport Inglewood Rose Canyon fault system. So we have been pre-planning for that potentiality as well. As I mentioned, we have our own ability to shelter evacuees if necessary, once again, not to compete with the Red Cross, but only to supplement our regional capability. We've done this on a number of occasions, both for Carlsbad residents in 2014 Poinsettia fire, and again for neighboring jurisdictions during 2017 Lilac wildfire. And of course, we've tailored all these to the environment that Ryan just talked about, the COVID-19 environment, to make sure that we can do congregate sheltering in a safe way, and those that we don't do in congregate settings like gymnasiums, we have prearranged with the property managers of our local hotels. I have a very short video. It's about 30 seconds of our Emergency Operations Center. This was the first, I think it's actually the second evening of our activation back on March 13th. We activated about 10:30 p.m. on March 12th. You can see how it's set up to monitor data associated with the unfolding pandemic. I think this display is a little bit slow in your presentation, but we are now coming to the right-hand side of the Emergency Operations Center. And I want to call your attention to these displays that have the green column of information, because shifting to the next slide now, it's a static slide of those screens. We, as I mentioned, we produced our plans to actionable tools, and we are now displaying in the second part of our EOC all of the city's essential functions that needed to continue to be performed during the COVID-19 pandemic. So we reduced our well over 600 or 700 city full service functions down to about 300 essential functions. You can see the status of how we're doing those in the green column markers on the display. You can see some identified as red, meaning that we hadn't completed that transition. And of those 300 or so essential tasks, a large number, and it varied from week to week and month to month, but between 50 and 60% of those were now being done remotely by telework and telecommuting. And so we believe that this process for pre-identifying our continuity of operations essential functions and the ability to quickly monitor and transition into a telecommuting role is extremely important for our workforce safety during the pandemic, but it'd be equally important during a large-scale earthquake when our infrastructure could be damaged. And the second key lessons learned from pandemic, the first one being our continuity of operations execution. The second lesson learned was the use of a system which Ryan already mentioned, and that was Microsoft Teams. We have imported all of our objectives and our incident resources, whether it's links to USGS or the California Integrated Seismic Network and other electronic websites, into the Teams environment. So we can access our incident response support applications either from the EOC in a staffed manner or remotely from laptops or cell phones from home. And again, this bringing forward of our Emergency Operations Center into the Teams environment has given us a remote virtual operations center capability. And all of those objectives and resources is now live in the Teams environment, as you can see in this slide. And these are the various 24 or more electronic resources that we would be monitoring immediately in the event of a earthquake scenario. They have all been migrated into the Teams environment. And I think the advantages are pretty apparent. It enables a quicker response. People don't have to travel to the Emergency Operations Center. They can log in immediately. It facilitates the development of situational awareness and information-based decision-making. And certainly it's available wherever there is connectivity to take advantage of this. I've gone a minute or two long, so I'm just going to briefly say that Carlsbad has had a very proactive community outreach program. We develop materials for our residents. We have a special program we call the Ready Carlsbad Business Alliance that engages our business community. And we've been conducting preparedness symposiums with our business sector for over 10 years. And this slide shows two on earthquakes, one from 2014 and one from 2017. Our emergency services group has also engaged other regional partners like InfraGard, and we conducted a regional earthquake symposium back in October of 2019. And the scenario was the Rose Canyon Fault. And we once again wanted to thank Dr. Meneses' presentation. It was really a landmark presentation. And then we had another speaker talk about the NERC, the Newport Inglewood Fault Zone System. We participated in other EERI opportunities. We thank you for that, and also at the National Earthquake Symposium. And we are converting this type of engagement into the electronic environment, either through Zoom or Teams. And this is just a screenshot of one of our Ready Carlsbad emergency preparedness presentations from a couple months ago. So We have a kind of a broad-based preparedness program. In addition to what I've talked about, we have a community emergency response team that's trained in certain aspects of earthquake response, like search and rescue training. We coordinate consistently, regularly with the county, both in terms of plan development and exercises. We participate in shakeouts and community-based events and support community programs. I'm going to pretty much close with this slide. This is a slide of how various city populations have fared during the COVID-19 epidemic. It's an infection rate, confirmed cases by percentage of population. Carl, and it runs from March to the present date. Carlsbad's infection rate, confirmed cases infection rate, is the white line. You can see where some other jurisdictions stand. Why do I show this? It's not to say that we are better than any other jurisdiction. I do think we've been fortunate, but I do think this is not a cause and effect relationship. I do think there is a relationship between focused, comprehensive planning and effective response. So I think we've been very fortunate as a community to have a lower infection rate than some other areas, but I do think some of that is attributed to some of the planning tools that we've implemented. And with that, that concludes my presentation. I apologize for running just a bit long, and I'll turn it back to you. Thank you.
Thank you so much, David, for your very wonderful presentation. We've enjoyed hearing from all of the speakers. And now is the time for questions. If you have any questions that you've not yet submitted, please do so into the question box that's on your menu. I do have one question here. Jorge, I believe this will be directed to you. This is from Marios Paniagitu, and it's regarding the earthquake scenario. How do the ground motion spectra computed compare to the ASC 7 design and MCE spectra for the downtown San Diego area?
This is a very good question. We did several comparisons, but before discussing this, we have to be very, we have to point it out that this scenario was based on a deterministic approach, okay? We are considering just one particular scenario, and based on that particular scenario earthquake, we developed the ground motions, and we could develop a response spectra at any location throughout the region. So this is deterministic, okay? Deterministic analysis. So the comparison by itself is not, I mean, we cannot compare oranges with apples, but however, this question was a common question sometimes. So we ran the analysis at different locations, and what we did is that we compare our results, and doing a probabilistic analysis is that I remember my recollection is that it was a close match to the 1,000-year return period using a probabilistic spectrum.
Thank you, Jorge. I'd also like to point out that the San Diego scenario is available for review by anybody who's interested in reading it. It's on the website. If you go to sandiego.eeri.org and select the earthquake scenario, you can download the documents, and there's an executive summary and a complete report that are available to anybody who's interested in learning more about the scenario, how it was developed, and any information related to ground shaking or the other hazards. If there's any other questions, please submit them now. Otherwise, I will be moving on. We just would like to thank everyone for participating today and for joining us. There's a post-webinar survey that will be emailed out. If you're interested, please help us by filling out the survey and responding to the questions. And we'd like to just ask also that everyone consider joining us with ERI It's a really great organization that is kind of a multidisciplinary group of professionals to consider advancing earthquake and looking at resilience in the United States and globally. You can find more information at eeri.org/join. Thank you.